All right, welcome back, everybody. This is episode 4 of Talk and Shop. Tonight we have two guests, both from, I guess, the medical field. We got a chiropractor with us and an athletic therapist. So I'm just going to get them to quickly introduce themselves, and then we'll jump into some questions for them. So if you want to go ahead, Tyler.
I'm going first, Maddie. Yeah.
Go ahead, Tyler.
My name is Tyler. As Brian mentioned, I'm a chiropractor practicing in Edmonton here, and we do a lot of stuff with actually both these two guys. I've worked with Brian before, and Matt is kind enough to send a lot of people my way, and his lovely wife also helps me out as well. So both of them are, really good at what they do, and I'm excited to hear what they have to say.
And as Brian said, I'm an athletic therapist. I've been working in the hockey realm for about 10 years or so in a few different capacities, both athletic therapy and strength and conditioning. Mainly interact with Brian through Premier Strength in the summers as a sport conditioning coach and therapist, working with Barry Butt. And I'm looking forward to chatting about some of the things today.
The first question I just want to kind of run by you guys. I mean, most of us are kind of sitting around just trying to figure out what to do until rinks open up and gyms open up and kind of get back into somewhat of a routine. So just the first thought, I mean, with all this extra time, we probably have a good chance to take care of our bodies and maybe get a little bit more healed up than some of us actually already are. So I just want to kind of pick your guys' brain about, I guess, what you kind of see the common areas that hockey players tend to kind of show up with, especially after a long season or as the season comes to an end. So if you want to go ahead first, Matt.
Yeah, well, I think there's kind of two parts to that from an injury standpoint. You have your chronic injuries that, nagging things where there's an underlying reason why the injury is there from a mechanic standpoint or a tissue breakdown standpoint. And then you have your acute injuries, things that you'd suffer like from a big hit or blocking a shot. So time off helps both of those for sure. Time off for the acute stuff, it gives them, it gives the athlete a good chance to, like you said, things to settle down, bumps and bruises to go away completely. Usually those disappear and you're ready to rock. And I think the time off for the chronic stuff, I think that's where a lot of the athletes now will really benefit from this forced time away from the rink, is that those kind of nagging, ongoing chronic issues will settle down. They won't go away because you have to also manage the underlying cause. But at least it gives a forced opportunity for that stuff to settle down, and then hopefully some of these athletes are starting to seize the chance that they have to work on those deficiencies, work on their their biomechanic issues or irregularities that are leading to those chronic or overuse type issues while they're off the ice.
Perfect, Tyler.
Yeah, I think that's exactly right, and I think you guys probably both see this. It's hard when, especially if we're trying to make it somewhere, it's hard to take time off. A lot of times we don't have that put into the schedule, especially if they're still trying to take that next step. And I don't know about you guys, but that's one of the big things that we see from people that are, where they want to be. Maybe they're playing professional versus I'm still trying to get there, is typically, and maybe hockey's not where it needs to be, but typically the pros will actually periodize some time off, some recovery into their plans, whereas some of the kids that are, whether they're still in school and training and playing, it's harder to find that time to make recovery a priority. So this forced time off, just like Matt said, is, as long as it's used like that, is probably a good window to get, again, both those types of injuries.
I've been talking to a few different people, and the one thing that kind of comes up, and it's interesting, a lot of people are saying that if we do jump right back into playoffs, you might see the best hockey you've ever seen, because everyone's going to have actually had that time to recover before they get into that high intensity, I guess, part of the season, right? Which is a bit of a different look than normal.
Yeah. What do you think, Matt? I think that's true. It's probably also hard. It'd be interesting to see if you can jump from doing nothing right into playoff intensity, and how having no fans would affect that. And also the guys in Europe can skate, and apparently Ethan Bear can skate, and none of the North American guys can skate. So I don't know how that would look, but yeah, it would be interesting.
Just a different dynamic, right? The next thing I kind of want to kind of pick you guys' brains about too is, I know the one thing that always comes up, and I hear this lots, is hockey players tend to have really bad hips just because the skating stride is such an unnatural movement. So is there some sort of, I guess, validness to that statement, like hockey hips having bad hips, or is that just some sort of made up term that we like to throw around?
Tyler, you want to start on that one?
Well, I guess everything's kind of made up at some point. Maddie's probably a little more into the current, what people are actually publishing now. I don't know if I've ever seen anything like published about hockey hips, but for sure there's some common imbalances that we'd see. And Matt, maybe you can weigh in on this. I probably think about this way more than I should. I don't know if it's a ton different in hockey players than I would see in other athletes that are doing primarily repetitive sagittal plane based stuff. And I don't know how much it is just the hockey, or if it's that I have to sit in class for 6-8 hours a day for 20 years and then I go and do that, or I go and do soccer or whatever it is, because I tend to see pretty similar patterns in all those types of athletes.
Yeah, I think I would agree. Like soccer is a good contrast, or a comparison, I should say. Sagittal being kind of straightforward, back and forth. I mean, hockey, obviously, you have a little bit of sideways movement in your stride, but generally speaking, it's still straightforward. And speaking anecdotally, a lot of soccer and hockey players that I've treated and worked with over the years, they present very commonly from a hip injury standpoint, most of the time being chronic. With hockey players especially, I think we see, because of their habitual pattern, their constant pattern of being in a bit of a hunch forward, pelvis forward, hip flexor shortened position, they're a little bit more apt to experience those overuse strains of the deeper hip flexors, the quad muscle. And then also a lot of times I'll find that a lot of hockey players are either kind of inactive or don't really use their front core, their anterior core, their trunk stabilizing muscles effectively. And so you start to see that breakdown. You see a stretching of the abdomen and or the ab muscles, and a pulling of the adductors, and that's where you start to get something like what's kind of commonly termed like a sports hernia, or pain kind of throughout the groin region, or that high groin pain is really, really common. And that's, again, kind of going back to my comment about overuse, that those chronic habitual patterns, if we can get them out of those patterns in the positions, that's good, but we still have to work on correcting the damage, for lack of a better term, the damage that happens with those structures. We need to strengthen them in an appropriate manner, or provide mobility in a certain manner that otherwise they wouldn't have. Again, with hockey players being crouched forward in a shortened forward position, we never really get them in that long, tall, open, lean position. So things that, again, going back to your first question of what could people be working on, that would be something that I would prioritize, especially, is getting away from that forward hunched, shortened front position.
Maybe the 4 months off of school won't hurt them with that either. Not sitting at a desk all day. They're all laying in their beds doing their homework, probably, right?
Yeah, if they're up and moving. I don't know, some of the high school athletes I'm still interacting with, they don't get out of the wrapper until 11 or 12 o'clock now. I don't really think that's much better.
Yeah, well, yeah, I've heard more like 2 or 3 Call of Duty for some kids. So you must know the keen ones.
Yeah, Call of Duty till 3 a.m. is a common pattern.
As long as they're not sitting on a chair doing it, I guess they're in a more of a reclined position, right?
That's fair.
Blanking themselves out a little bit.
Lining. Yeah.
Kind of just on top of that too, the other thing, obviously hips play a huge role, but if you kind of look from the hips down, I find with a lot of the players I work with, if there's a restriction in their ankle mobility, it makes it a little bit more challenging for them to kind of have the technical stride that I want to see them have. For example, I had a player that really, really severely broke their ankle, kind of caught an edge right by the boards and shattered their ankle, and it's all pinned back together. And you could just really see the struggle in that player initially coming back from the injury, while also kind of long-term, where that mobility just never fully kind of came back. So that's kind of one thing. Is there room to grow in that area for players if they really are restricted through the ankle?
Well, I think, being in the nature of hockey, being in a restrictive boot, especially unfortunate, and I'll say I'm happy as far as athletes being off the ice for the amount of time they are because of, for a reason just like this, getting them out of the boot and getting them moving more regularly and more frequently in different manners and more often than they normally would have is beneficial. But I think being in a skate for 9, 10, 11 months of the year with a lot of these athletes leads to that general restriction. I don't think it's something that's a structural change necessarily. It's just they need to have an opportunity to allow that ankle to move through ranges that they otherwise wouldn't experience being locked into an immobile boot. And oftentimes they're capitalizing on range of motion through the knee and the hip joint to actually accomplish movement at the ankle joint because their ankle joint isn't moving quite so well. From a treatment standpoint, I'm sure Tyler, I'll let you weigh in on some things that maybe are worth recommending. But yeah, I think even just time out of the boot on my end has a lot to do with them getting more mobility and moving better through their ankle.
Yeah, for sure. And I think you probably see the same thing. And I think squat's pretty fundamental. So we do a lot of looking at that for people. And I think you see a lot of the same limitations. I assume, Brian, you're talking about mostly like dorsiflexion.
Yeah, like knee over toe, kind of getting that weight to load forward to the ankle.
Yeah. So, and Matt, I assume same thing. You see that when you're talking about when they're getting more movement from their hip and their knee in a gym, right? If we're limited through our ankle, they're going to start to load other places. So that's for sure a common deficiency that I see. And as far as getting it better, therapy wise, probably helps a little bit. I would probably lean more towards some rehab of, again, at least getting out of the boot, getting some weight bearing mobility exercises. That probably comes faster. Because those are big, strong areas. Just pounding those tissues out is, maybe helpful to get them started, but it's a pretty tough slog if they're not doing some good functional rehab with it.
Yeah. The other thing too, like the boot, I know that some of the guys I've talked to as well, I just talked more about adjusting the lacing patterns and adjusting the boot to increase range of motion as well. Just because, like you said, the boot is so restrictive. But some guys you'll talk to will tie their skates a little loose, so they'll skip eyelets. There's lots of things that you can do from, I guess, an equipment standpoint that might actually get you more value than some of the actual rehab and functional stuff, right?
Well, and I've seen, like, even when those first, I remember when those Easton Mako skates started coming out, the feedback I was getting from guys that it immediately put them in a better dorsiflex position to start their stride in. And you're right, I've seen a lot of guys kind of replicate that ability to get more knee over the toe by just loosening off their top two eyelets or top eyelets. And yeah, it is interesting what can be played with to kind of create pseudo or fake dorsiflexion or fake movement through the ankle joint, through the boot. But it shouldn't, like Tyler said, it shouldn't replace just working through a good, healthy, loaded, which is important to note, like Tyler said, loaded ankle range of motion to get the body adapting back into that ability to have all that full range, so that when you make the modifications to your equipment, you have the available range at your ankle joint. If your ankle joint is stiff and restricted to begin with, taking off 2 or 3 eyelets isn't really going to change much if your ankle doesn't want to move in that way anyways.
Yeah, no, for sure. The other thing,
and
go ahead, Tyler.
The other thing is if you have some ideal range of motion and I take either impact or something pushes past where I can get to in my skate, if we have a little bit of wiggle room there, then it stops something from exploding, which is good. So I'd always want to work on getting as close to functional range as we can, even if they look okay on the skate and they have nothing extra. That's not the best recipe for especially contact sport.
Yeah, just kind of putting yourself in a safe position to, I guess, get the ankle through the proper range of motion while in the boot and off the boot, right at the end of the day. Just trying to mirror those two movement patterns.
Well, and here's like, Tyler, you can weigh in on what you think. I usually like to see guys, especially hockey players, like I think like 38 to 45, 42 to 45 degrees of dorsiflexion is kind of that sweet spot that I'm usually really happy with seeing. And if people are seeing this and they're interested in checking that out, just if you have an iPhone, you have an inclinometer, you can just put that little level on your shin and you can kind of test it out by keeping your heel grounded and pushing your knee past your toe. It's a real simple test. And it can kind of give you an idea of, like, if you're at like 25 degrees, that's kind of a red zone. That's not a healthy range. If you're in that high 30s or 40s, then you have the available range of motion. And it might not be something that's limiting your stride if you have issues with it that way.
Yeah, and it's something that's easy to track and easy to track bilateral.
Definitely.
You'll track improvement pretty quickly.
Yeah.
Yeah, I like you kind of mentioned 35 to 45, and that's exactly basically where I'd want to see them in a boot on the ice too. So there's a definite kind of correlation between those two situations, right?
Yeah. So then even like going on Tyler's point, if Brian, you want to see that, like, let's say 40, 42 is our sweet spot, then out of a boot, you better have at least 45 degrees of motion, maybe even like 45 to 50. So it just leads to that, like how much more beneficial it is to have a good, healthy range of motion through the ankle joint, to be able to perform the stride that you want to see biomechanically, but then also have that little bit of bandwidth, that fluctuation, that ability to absorb extra load or extra shock that might come with contact or collision.
Perfect. What do you guys think, just in terms of kind of a final question here? If you are sitting at home and trying to find some ways to pass the time, what are some of your best values? Like, are you thinking hopping on foam rollers, on a lacrosse ball, stretching? Where do you guys think people should try and spend a bit of time?
I'll go first, Maddie.
Well, I've been asked this question a few different ways over the last little bit, and I kind of formulated my message has been consistent, is that this is an opportunity to truly start drilling home on your deficiencies or areas that have always been a bit of a weak spot. And so everything you mentioned, Brian, everything can be applicable, but everybody is different. So there's not a golden take home, hey, do these three exercises and you're going to be sweet. But what I have said to my athletes that I'm working with is that, there's going to come a time where things are going to ramp up and it's going to get really busy really fast. And then now we're in that kind of danger zone from a potential overuse, overworked injury standpoint. So take care of the little things, take care of all the small deficiencies, the nagging groin or the shoulder that's a little bit stiff and achy after you shoot 100 pucks. Get on top of that stuff now, whatever that might be. And it might be trigger point, it might be mobility, it might be yoga, whatever it's going to take to manage that. But have that in your daily routine. When things are quiet, you should have a 30 minute daily routine that you can nail all those things, so that when things get crazy, you're not going to be, you'll have hopefully less likelihood of self-destructing and falling apart as your intensity and your workload ramps up substantially, whether that's September, October, or whenever it does happen.
Yeah, I would agree. I don't know if I would have anything particular that I think everyone could do, because everybody's going to have some different limitations. I think the other thing that this gives people a chance to do is to make a plan, spend some time thinking about, either deficiencies that they want to work on or what their goals are, and really get that part of it dialed out so that they can, again, work on whatever it is they can work on now. I think most of the stuff that Matt said would probably be my, more in my wheelhouse. This is a time where maybe they don't have access to do all of the, intense stuff that they maybe want to do. So it's a perfect time to work on the stuff that maybe isn't as sexy or as fun, but that builds the foundation for them to be able to push it when they can, without breaking down, without having something pop up injury wise or whatever it is.
I guess there's also a bit of like the other side of that equation. If you do have the access to all the equipment at your house and you're kind of lucky enough to have it, now maybe you're actually possibly damaging yourself more than you actually know as well, right? You're just going through poor ranges of motion and maybe too much weight, thinking you're going to get ahead of the next guy beside you, and who knows where you end up, right?
Well, I mean, yeah, for those, I guess a message to that, like for those that have the tools and the equipment to essentially train unrestricted or train as they normally would, I would just say make sure you're reaching out to somebody that can give you that guidance. I know Barry's been doing a lot of virtual stuff. There's a lot of support out there. And if you don't have the training age or the training experience to be following an advanced program, then yeah, make sure you have that support out there with how all this, online stuff is developing so quickly. It's actually pretty easy to provide from a therapist or strength coach standpoint. It's easy to provide some really good guidance and break down squat technique or whatever it might be. So if people find themselves in that position where they're really trying to make huge gains in this downtime, which absolutely, if you have the resources, you should be. Why not, right? Capitalize on an extended off season. Just make sure you have the support out there to ensure that you're not causing more harm than you are good.
For sure. Anything to add, Tyler?
Yeah, no, I think that's exactly what I would say. And like you said, there's tons of resources now online, even local stuff. There, it would be pretty easy to find whatever help you need to either dial some stuff in programming wise, or if you have some nagging injuries, if you want some more specific kind of rehab, prehab type stuff, it'd be pretty easy to find.
All right, sounds great. Thanks for hopping on, guys. So hopefully I can send some slightly injured people your way when we get back on the ice, or maybe hopefully not, I guess.
Hopefully not.
But
Yeah,
have a great rest of your week.
Yeah, nice to talk to you, boys.
Cheers. Thanks, Brian. Thanks, Tyler.
Thanks.